This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Hisone 10mg tablet is a corticosteroid medication that helps replace insufficient adrenal hormones in the body. It is crucial for those with adrenal gland issues. Indications and uses. This medication is indicated for replacement therapy to address insufficient adrenal hormone production due to an inactive or underactive adrenal gland. It is also utilized to inhibit adrenocorticotropic hormone when administered with aminoglutethimide for specific cancers. Moreover, it assists in managing various illnesses and restores adrenal hormone levels after traumatic experiences, surgeries, or other stressful events. How it works. The tablet works by replenishing cortisol levels in the body and blocking certain chemical messengers responsible for inflammation and allergies, providing relief from swelling and pain. Directions for use. Take the tablet as prescribed by your physician. It should be swallowed whole with a glass of water, and it must not be crushed or chewed. The correct dosage and treatment duration will be determined by your doctor based on your age, body weight, and specific health conditions. Possible side effects. Common side effects may include mental health problems, while rare side effects could involve palpitations, severe allergic reactions, and increased blood sugar levels. Precautions and warnings. Caution is advised for individuals with existing health issues such as kidney or liver problems, pregnant or breastfeeding women, and those with a history of mental health disorders. It is essential to disclose any past medical history to your healthcare provider prior to starting this medication. FAQs. 1. What is this medication used for? It is used for replacing insufficient adrenal hormone levels in the body. 2. What are the common side effects? Mental health issues are the most common side effect. 3. How does it work? It replenishes cortisol levels and reduces inflammation. 4. How should it be taken? It should be taken as prescribed, swallowed whole with water. 5. Is it safe for pregnant women? It should be used with caution during pregnancy. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is always appreciated.